Hello and welcome to another episode of Cracking Addiction with Philippe and Naren. In the episode of Cracking Addiction today, we're really privileged to have Dr. Jim Connell on the show with us. So Dr. Connell's the co-founder and medical officer at Heyday Medical. So Jim is a doctor and a GP who's got a real passion for the field of medicinal cannabis, and through his own journey to educate himself, became passionate about cannabis education and improving patients' and doctors' understanding of this complex herbal medicine, as well as the endocannabinoid system through which it exerts many of its actions. With this passion for cannabis medicine and education, he was appointed the president of the Society of Cannabis Clinicians Australian Chapter 2021 to 2022, and he has co-founded a medicinal cannabis product and clinic company with the goal to create unique Australian-grown cannabis products for Australian patients. Through education, integrative medicine practices, and an expanding formulary, he hopes to be able to help Australian patients achieve optimal health outcomes and live their best lives. So, Jim, welcome to the show and thanks for joining us.
Thank you, Dylan, and thank you so much for having me. It's a pleasure to be here.
Great. So I guess we'll start off with the questions. And the first one is, can you discuss and explain the endocannabinoid system for us?
Yes, that'd be my pleasure, because for a lot of listeners, it's probably the first time they've heard about it or been educated in regards to this system. And thinking about that, you'd believe it was a small system that had very little influence, on the physiology of the body, but it's anything but that. The endocannabinoid system is a widespread system throughout our body, with its main role to balance and fine-tune our body's responses to stresses. So it helps us respond to stress, pain, mood. It is pivotal in regards to our protective mechanisms within the body. It sort of helps us eat and maintain satiety and undergo metabolism. So, look, its roles are many and varied. And a good way of thinking about it is our body is like a complex symphony orchestra, and the endocannabinoid system is like the conductor. So it's not always playing the parts, but it's there making sure that all those parts work together in harmony and trying to bring them back into balance to maintain optimal health conditions for us to be able to thrive in.
Excellent. So can you talk to us about cannabis and the cannabinoids that comprise cannabis? Because there are quite a few cannabinoids that comprise the cannabis plant.
Yeah, so cannabis is a complex herbal medicine with hundreds of different active components. The most recent, counts are over 700 active constituents within the cannabis plant. Within the cannabis plant, the compounds that are quite unique to cannabis, look, there are some other plants that produce cannabinoids, but they're predominantly in the cannabis plant. And so these cannabinoids, of which there are around 160 of, are quite biologically active compounds. Some of the activity is through the classical endocannabinoid system, which is there to balance and regulate a lot of these internal processes. But many of the cannabinoids actually work through a range of different sort of receptor subtypes, neurotransmitters, enzymes, and have quite a diverse range of action. But the main cannabinoids that we're going to base most of our decision-making around when we're applying cannabis clinically are the two main compounds, THC and CBD, which are quite different in their mechanism of action, but both quite broad-acting medicines and are useful clinically across a range of different conditions. But outside of these two major cannabinoids, we also have a lot of other major minor cannabinoids of interest, and we're going to be seeing a lot more of these on our market hopefully soon. So things like CBG, CBN, CBC, THCV, all with different sort of potential therapeutic sort of areas where we could be fine-tuning our responses with cannabis. And these cannabinoids we're talking about are cannabinoids in their neutral form. So once they've been decarboxylated, where that carboxyl group has been taken away from the precursor molecules, the acidic cannabinoids, and these actually show a lot of therapeutic promise as well in preclinical sort of studies. So excited to see where the future sort of goes in regards to cannabinoid sort of science and its clinical applications, but there are multiple other compounds that are therapeutically active within the cannabis plant as well. Some of these, the most probably well recognized, are the terpenes, and they're the aromatic compounds within the cannabis plant that give it its smell, but they also dictate some of the mood of the medicine. So you can have a similar product that has the same amount of cannabinoids in it, but with a different terpene profile, and you will have different effects. So some products will be uplifting, energizing, more creative. Others will be more sedating, more relaxing, and have stronger analgesic properties. And it will be these other constituents within the cannabis plant that are often creating these specific effects.
That's really amazing, and it just kind of shows that complex interplay where you actually have to think about the different component of cannabinoid you're prescribing to someone, combining that with, say, terpenes. And I guess brings me to my next question about the history of medicinal cannabis. Can you explain to our listeners and viewers some of the history of medicinal cannabis, how long it's been viewed as a medicinal component and its pathway to now?
Of course, just on that, the complexity of the cannabis plant, though, we need to look at a different way with these pleiotropic medicines and look at network pharmacology, which is a new way of, I guess, studying how these are interacting within the body. But when you look at the history of medical cannabis, cannabis has been used throughout human cultures and societies for millennia, with some evidence that it was probably the oldest domesticated plant, being domesticated around 10,000 years ago, with evidence of cannabis being used as a medicine in ancient texts in China, all throughout the Middle East, here through Roman and Greek sort of times, even through Renaissance and medieval periods. There's a lot of references to cannabis for uses that we're commonly using cannabis for these days, be it pain, be it sleep, be it for mood disorders as well. But probably the strongest evidence for cannabis use historically comes in the 19th century, where cannabis was actually used as a common medicine by Western medical doctors. It was brought into the limelight by a Dr. William O'Shaughnessy, who was a Scottish physician, after his travels to India, and he brought the hashish back to the UK and studied it in Edinburgh. And from that period of time between the 1840s and the 1930s, cannabis was one of the most widely prescribed medicines, and was used across a wide range of clinical conditions. I think 100 different clinical conditions where there'd been quite, a reasonable body of evidence, case reports and studies showing the benefit for medical cannabis, often, in conjunction with other medicines of the time, and used, for other things like for poppy addiction and aiding in withdrawal of that sort of process, which became a bit of a scourge in the late 19th century.
Excellent. And currently, what are the current indications for medicinal cannabis?
So in Australia, the indications are quite broad in that there's criteria that need to be fulfilled. And those criteria are that you're treating a chronic condition that hasn't responded to other first-line therapies, and that there is some evidence base that cannabis could be a beneficial treatment for that. And because of the wide-ranging nature of the endocannabinoid system and its involvement in pretty much all chronic disease or the progression of chronic disease, then really based on those loose criteria, cannabis can be an application for cannabis can be applied for pretty much any chronic condition. But the most common conditions that cannabis is being utilized for, chronic pain being the number one by far, but then things like insomnia, anxiety, cancer-related symptoms. We also have a lot of neurological sort of disorders that we're using cannabis medicines for. But then there's things like autism spectrum disorder or behavioral disorders that are also where we're also finding benefit with cannabis as well. So it is quite broad and quite diverse as like the medicine itself.
Yep. And I guess regarding those indications, and certainly as a GP, I certainly see people asking about the evidence for cannabis in terms of anxiety, depression, and that chronic pain and sleep. But also I see a lot of patients asking about using cannabis as an opioid-sparing agent as well. Could you talk to us about some of those indications about anxiety, depression, and that chronic pain, and where cannabis stacks up evidence-wise as an evidence-based intervention for these indications?
Yeah, look, this is a common question we get sort of asked, and it is quite difficult when you think about the plant nature, the complex herbal medicine that we're sort of working with, that no two medicines are the same. And so it doesn't necessarily, one, one product does not equal another product, and the efficacy does shift and vary. But in regards to those conditions you sort of discussed, depression, anxiety, sleep disorders, pain, opioid-sparing agents, from a preclinical sort of model, and looking at the role of the endocannabinoid system in regards to these, the development of these conditions and symptoms, there's a strong theoretical basis around how beneficial modulation of the endocannabinoid system could be in regards to improving the outcomes for patients with these issues. In regards to the gold standard of evidence, which is the large randomized controlled double-blind placebo trials done by independent sort of bodies, the evidence is lacking. There's been very few studies. There's little incentives, I guess, to do those studies on a naturally occurring sort of compound, and the studies that have been done are very mixed. So, so in regards to anxiety and depression, from clinically, I've seen cannabis be beneficial in the right patients, especially CBD predominant sort of treatments, during the day as something that helps reduce the intensity of anxiety type symptoms. In the evening, THC can be really beneficial in helping with sort of relaxation, unwinding, forgetting the stresses and burdens of the day, and helping people prepare for sleep. But too much THC or chronic THC use can actually worsen anxiety disorders, and that's likely due to how it disrupts or dysregulates the body's endocannabinoid system further. So it's very much dose dependent and medication specific in regards to the results you're going to see. In regards to depression as well, it would depend on the patient and their own self-efficacy and capacity for motivation, because THC can be euphorogenic, can help people with their mood, but it can also cause apathy or listlessness and a reduction in desire to want to go out and do things. So you want to choose the patient sort of carefully. If you can use cannabis in a way that helps them engage positively with the world around them, helps them to do exercise, to make social connections, to find joy in life, it's going to be a very beneficial treatment. But if it's something that makes them feel more comfortable staying at home and just lying in bed and blocking the world out by throwing the doona over, then it's probably going to worsen their outcomes in the long run. So the way I see cannabis is a functional medicine. So we're looking at those functional outcomes rather than looking at the symptoms specifically. If our goal should be around improving someone's quality of life and helping them engage more positively in life. And if that's being achieved, then I say that's a success, despite what the scores might be in regards to anxiety or depression sort of scales or these types of things. In regards to pain, the best studies were probably done around 2015. I think Whiting et al., there was a NASM study, which is the National Academy of Science, Engineering and Medicine in the States in 2017, that looked at the current evidence for cannabis across a range of different conditions. And they showed moderate improvement for chronic non-cancer pain from the RCTs that they'd looked at there. But since then, there's been people looking at the same studies, choosing which ones to include and which ones not to include, and the results are different depending on how people are selecting the products. And like I said, we're not always using the optimum treatments for those patients because we're not doing it on an individual basis, because there is such interpersonal variability when someone experiences cannabis, and also so we have to choose the right product for that specific patient. And then as an opioid sparing agent, I think this is something that I'm really excited about. The endogenous opioid system and the endogenous endocannabinoid system are co-located quite strongly throughout the peripheral and central nervous system and peripheral sort of organs, and they do have a lot of interaction together. From preclinical and animal study models, there seems to be a cross-linking effect with THC specifically and the opioid receptors that increases the effectiveness of opioids. So a subtherapeutic dose of THC combined with a subtherapeutic dose of an opioid combined can actually make a therapeutic medicine. So this is going to be beneficial in helping people sort of get maximum results with opioids while being able to maintain the lowest effective dose. One of the beneficial things about the endocannabinoid system, it is ubiquitous to most parts of the body, except it is there are no cannabinoid receptors in the parts of the brainstem that control cardiorespiratory function. So combining THC with opioids, there can be a potential synergistic sort of benefit without there being an increased risk of harm or death associated with, respiratory depression or cardiac sort of depression. So I've seen myself significant improvements using the two together, where we've been able to reduce the dose of opioids, sometimes causing opioid cessation, but generally it's a lower dose of opioid-based therapies, and also to prevent people from going on to escalating doses of opioids as well. They seem to get longer benefit at a stable dose. Once again, there are a lot of case series that support the use of cannabis as an opioid-sparing agent, observational sort of data, so patient-reported outcome measures that have been looked at. You see states that have legalized cannabis and you see reductions in deaths from opioid overdose or reduction in prescription pain medicines being used. But then when you look at, once again, the large bodies, the RCTs, the evidence is mixed and inconclusive.
That's a very detailed answer. And I guess the thing that I wanted to ask, and it's probably the last question that we'll do in this episode of Cracking Addiction on medicinal cannabis, because it's such a big topic, we'll spread it over the two, is you mentioned patient selection and selecting for patients who are going to be proactively engaged with their therapies. Are there any other patient selection criteria you use when you're making the decision about whether or not to start someone on a medicinal cannabis product?
Look, there are multiple sort of things we're going to be looking at. So, often the patients that often respond best to medical cannabis are those that have comorbid sort of conditions that might also be affected by modulation of the body's own endocannabinoid system. But with that, they come with a range of different other medications. So we're going to be looking for the medication sort of interactions. We want to make sure that that person also, like we said, is motivated. They haven't had significant issues with drug and alcohol abuse in the past. They don't have end-stage liver disease or cardiac disease or a few other things. But to be honest, it's mainly done on an individual basis, and certain cannabinoids might be excluded from a certain patient, but we have access to other cannabinoids that might be beneficial and might be safer in that patient population.
Excellent. Well, I'd like to bring this episode to a close and certainly thank Dr. Connell for his experience and his knowledge that he's given us on this episode. So Dr. Connell will join us in our next episode of Cracking Addiction while we explore medicinal cannabis in a bit more detail. So to the listeners and viewers, thank you for your attention and bye for now.